Today I'm going to be doing a hip and full back massage for the lovely Sophia. Let's go ahead and get started. So for this hips and back massage, I am going to start along the IT band and kind of work my way up. And before I really get going, I like to, wherever I'm going to start, I like to just place my hands for a second and let my client get used to my touch. I'm just gonna work my way up this IT band pretty gently, helping my client to settle into greater awareness of their body, just sinking into the table. And I am wrapping my tools, my soft fists, around the iliac crest and just searching for any connective tissue that feels extra sticky or kind of stuck, avoiding any bony structures. And I'm going to start just some gentle rocking. This is really good for the hip joints. It's a great distraction technique, especially as I start to apply a little more pressure along that thick fibrous tendon on the side of the leg. I'm going to do one more pass along that IT band. You might find that you need to step away from the table, just create a little more space so you can go into that area with your core. If you're crowding the leg, it's really hard to get that angle that you need, that pressure. You're never going to change like the degree of tension in that tendon, but you can stimulate it in a way that's really healthy for the hips, for the low back. Usually, if the hips feel especially tight, I will work on the glute medius and also the glute max. And I always start with the glute medius. So I'm going to go ahead and just land on that area. And I'm doing almost invisible circles, just feeling for any trigger points, areas that feel locked up, restricted. Really depends on my client. Sometimes with smaller framed people, I have an easier time working with my elbow because I can use the table, just feel a little more stable. I find that just this gentle movement can help me have an easier time really work through some of that tension in a lot of my clients. Really important to read your client though. Sometimes if someone's feeling especially stressed or whatever, that movement is going to feel distracting. And if you feel your client start to resist the level of tension that you're offering, obviously check in with them. when you're using your elbow, it's not that you don't have sensitivity, but it's harder to always be aware of if you're offering too much as you start to do deeper work. If you feel like your client's just overwhelmed and tired of the deeper work, you can always just take a little break and revisit if you feel like that medius needs more attention. I think that's good for now. And I'm going to transition to this glute max. So simply applying pressure to this big, powerful muscle, I don't find it to be really that helpful or effective, but this is great for just bringing attention to that area and warming up the soft tissue. So to really start to isolate that muscle tissue in a way that's going to help that area, I'm going to just use some active release or a pin and stretch. So just making sure that Sophia's leg is nice and relaxed. So sometimes it's okay, just relax, and making sure that she's not trying to help me. So just lifting the leg and really encouraging Sophia to just relax her leg and not try to help at all. The more relaxed the glute max is, the easier it is for me to know where the true blocks are or areas that I need to focus on. And that internal external rotation allows you to really stretch that muscle tissue, that muscle fiber, in a way that opens everything up. And Sophia hopefully gets off the table feeling more space, more freedom in her hips as a result. I'll usually slow way down if I land on a trigger point. It is really helpful for the low back and the hips if you can access the piriformis, but if you're fighting with this glute max, I would just save it for the next session, because that piriformis is going to be pretty elusive if you're not able to work through some of the other tension, this bigger muscle. And Sophia's muscle is responding really well. I'm going to go ahead and land on this piriformis and continue with that same internal, external rotation. The piriformis is a deep muscle, so it's just deeper muscles in general are more challenging to work on. I'm starting with a broader surface area, so I'm not just jamming my elbow in. I'm really softening that sensation by using some of my forearm as well. And if things are responding well, you can begin to sink your elbow in a little bit more. That sensation is going to start to feel a lot sharper. So just gradually offering more pressure. This kind of work can do wonders for the hips and ultimately the low back too. And don't, try to be perfect. Like, this kind of work can be challenging in some ways. So just kind of letting good enough be good enough and saving some for the next session. Moving on to the next phase of the massage. You also don't want to go from like super deep to just like jumping onto the back. You want to find these transitions that are like creative and artistic, honestly, sometimes just tying everything together in a creative way, making your massage your own. I'm just going to land on this connective tissue around the hips. And I'm going to rotate this pelvis, just opening up the low back and the spine a little bit more. And sometimes, like, you'll just have to make these choices when you spend a lot of your time in an area that you weren't expecting. You'll just have to kind of make some changes because you don't want to go over on time. So I've learned a lot about like boundaries being a massage therapist and all of that. So I'm going to go ahead and just end with some dry work, and I'm going to walk my thumbs down, of course checking to make sure that your client's comfortable. There's a lot of nerve endings in this sacrum, and I'm just going to walk my way down. This is a really great way to finish that glute work, which I ultimately was doing for the hips and the back. And tapping is a very underrated, underused massage technique that can do wonders for blood circulation. And I'm going to go ahead and actually end with some simple tapping for the back. Sometimes I'll do this if I run out of time working on the glutes. It's just a really simple way that you can do something that feels really good to your client. That's also very healing. I'm just going to slow it down. Make sure this upper back is feeling good when Sophia gets off the table. And that mid back as well. I'm just bringing that into the glute medius. And I'm going to end with just that same stretch for the spine, holding for a good 20 seconds or so. And that is all for today.